Hi,
Teresa.
Teresa.
Good morning.
Good morning.
It is bright and early here, so
Where
I
are
hope
you?
everybody's awake.
Where are you?
Iowa.
Oh, yeah, it's even earlier there, I guess.
Yeah.
Yeah.
Central Time.
Okay. Is this Debbie?
Yes, this is Debbie.
Okay. Are we good to go then?
And I'm Dr. Friedman as well. Yeah, both
Okay,
of us.
Dr. Friedman, glad to hear your voice. Okay, are you ready?
Yes, we're ready.
Okay, great. My name is Teresa Seddon, and I am the media spokesperson for Wired4Life.net, and we are an online support group for women with pacemakers, ICDs, and implantable cardiac devices. So to find out about the Join the Pacemakers campaign is a huge, exciting thing for us. So Debbie, I want to start with you. I know that you are just hugely famous, and it is an honor to speak with you. But how did you get involved with the campaign?
Well, Teresa, heart disease runs in my family. I lost my dad, my aunt, two aunts actually. My Uncle Joe was one of the first recipients of a heart transplant from the famed DeBakey team in Houston. And recently, one of my best friends had to have a pacemaker. And I was really very, very concerned about, the condition. And then we found out that, historically pacemakers are not compatible with MRIs. And MRIs, as you know, is one of the most important diagnostic tools in the medical profession. I've had 3 in my lifetime, from bodily injury from dance or just things that they wanted to look at to make sure that they were okay. It's the soft tissues that the MRI gets a captures a great image of. That's the brain, the heart, muscles, ligaments, all of those wonderful things that we need to know how is everything working. So when I found out that now there is new technology, that there is a pacemaker that exists that is compatible with MRI technology, I said, well, we need to get that word out, because I don't know if people that get pacemakers even know to ask, are there options? Are there different kinds? I mean, I didn't really know until my friend had to get one that you would be curious to know that there's, different kinds of pacemakers. And so I think it's important that the public knows that there is new technology, there are options, and that we are able to have this really really important conversation with your healthcare giver to say, I would like to know what my options are.
I think that's really important, because I think a lot of pacemaker patients, it's such a fast thing when you get it. That go in, you get one, you come out, and you don't really think to ask these questions. So it's really fantastic that you are speaking out, you and Dr. Friedman both, to let people know that, hey, there is an option out there. Dr. Friedman, knowing that you already work in the healthcare field, before you got your pacemaker, did you know that there was this opportunity?
Actually, no, I didn't, and that's why I kind of wanted to join this campaign. When as a radiologist, I'm reading the MRIs, or I'm reading all the imaging that's done on patients, and I see all these patients that come into the emergency room, they think they're having a stroke, and we want to get an MRI on them, and they can't get one because they have one of these traditional pacemakers. And to me, that was something that it was just, hey, if you have a pacemaker, you're pretty much never going to get an MRI. And MRI is increasing in its use. As Ms. Allen said, it's being used for stroke, it's being used for fractures in the elderly population in their backs, it's being used in orthopedics for the younger patients, it's being used for neurology. I mean, it's cancers, it's you name it, it's pretty much being used. And people think of pacemakers as just an older population, but I'm 38 years old. You can be, a child, you can be an older patient. Patients, are getting pacemakers at all ages. And I didn't even know this technology existed. And when I was first told I needed a pacemaker, I was very reluctant. I said, I'm not getting one. And I joked around with my doctor just saying, hey, when are you going to get a pacemaker that can be used in an MRI? Because I don't want to be one of these patients that can't get one. And he said, it's funny you should ask. A few weeks ago, it was released onto the market, and the FDA had approved it. And I was like, that's the one I want. And so I wanted to join this jointhepacemakers.com campaign to educate patients and let them know you have a choice. You have a place you can go to that has a wealth of information, not just on pacemakers, but also on the different indications of why you would get pacemakers, other choices besides pacemakers, what an MRI is, the difference between the traditional pacemakers and this pacemakers. I mean, there is just so much information on this website. And I want patients to realize that they have a choice. They can be their best advocate for their health by talking to their physician, doing their homework, and doing their research, because the person who's going to care most about your health is you. And I had that choice because I knew to ask questions. I didn't even know this pacemaker had existed, but at least I knew to ask the questions. And that's what I want to get out there, to have these patients ask the questions, talk to their doctors, because you do have a choice. You don't have to get whatever is on the table for the, you can ask for what you want. And that's important, I think, in patient healthcare.
And that is very important, to be able to advocate for yourself. Now, Debbie, in the case of your best friend, when he got his pacemaker, did they make him aware that what's the possibility of, one, he wouldn't be able to get an MRI with a traditional pacemaker, and two, that there was going to possibly be the option to have one where he could get a MRI later on?
No, when he got his, there was no discussion about a choice, but this technology didn't exist. And he also didn't know that he couldn't get an MRI when he got the pacemaker. He didn't get that information. So now, if he needs an MRI, the question is, what is he going to do? What's going to happen? That's a big question. It's a big question.
And I find that's a big question with a lot of people that have pacemakers.
Yeah.
Because they're not made aware of it before the implantation actually happens. Dr. Friedman, if I could ask you, 38, it seems really, really young to have a pacemaker. What was your diagnosis that brought you to having a pacemaker?
My medical diagnosis was cardioinhibitory vasovagal reaction, which in layman terms, basically, I had episodes of passing out, and it was passing out because my heart was stopping under certain circumstances. It was nothing that I was told was life-threatening. It was nothing that the danger of it was these episodes were happening so rapid that I wouldn't have the ability to respond to make sure I can, if I was driving a car, to get to the side of the road, or I, prevent myself from hitting my head as I, passed out. And so it was really important that I had some sort of control. Like I had mentioned before, when I was told, I needed a pacemaker, I was very reluctant to get the traditional pacemakers because they can be very dangerous in an MRI environment. And when I found out there was this one out there that was designed specifically for the MRI environment, I was like, I want that one, not just because I can do my job, continue to do all aspects of my job, because I respond to patients in the MRI, but I can get an MRI down the road if I needed to. My 9-year-old daughter needed an MRI of her brain, and she wanted her dad to be in there holding her hand. And if I had the traditional pacemaker, I couldn't be there. So, I mean, just you never know when you might have to be in that MRI. Even if you're, I'm a healthy guy. I play soccer and I run. I don't take any medications. And all of a sudden I needed this pacemaker. So it can be young patients, old patients. You never know.
Exactly, and I'm sure that was just almost heartbreaking to think that if you had had a traditional pacemaker, you couldn't have been with your daughter.
Absolutely.
And so that kind of brings me to my next question. As a patient, how has it affected your perspective as the radiologist?
Well, obviously I've gone, on this campaign to try and educate patients, but at the same time, I've been trying to educate doctors as well. I'm in a practice in St. Petersburg, Florida, and I've educated all my partners in the practice and my colleagues in the practice and my technologists to say, hey, listen, now having a pacemaker doesn't necessarily preclude you from having an MRI. We have to figure out which pacemaker you have. And the beauty of this pacemaker is with a simple chest x-ray, somebody has this one. And so we can now look for it and say, hey, you know what, some patients are going to be able to get an MRI now with a pacemaker, and some people cannot. And so I want to get out that information, because not just to the doctors, but also to the patients, that, hey, this technology is there, and honestly, if you have a choice between a pacemaker that can be used in an MRI and one that can't, I recommend to my patients, I recommend to family members, loved ones. It was the choice I made. I'm doing that one that allows me to get an MRI.
Debbie, as a friend to someone who has a pacemaker, has it affected your perspective of your friend, you know, like, I have to be careful with what we do, or things like that?
Well, no, it's really kind of really been good for me because he's changed his whole diet. He's still very active. He's very physical. But, you know, he's educating me about the changes in his diet in particular, just to, you know, you don't just want to just get a pacemaker and say, okay, that's the solution to my problem. Sometimes you need a lifestyle change that goes along with it. So actually we're eating no red meats and little oil as possible, nothing fried, no dairy. These are things that are really good for you in longevity. So it's been a positive situation all the way around, and we're really happy that we've been able to spend this time to share this information with you and your audience, because it's very important, and we know that this is going to change lives.
And we so appreciate it, and we appreciate you being the spokesperson for this so very important campaign. And what's in the pipeline? Because I've loved watching you on Grace. I've watched you on Fame.
Yeah.
What do you have going on?
Oh, I got the Hot Chocolate Nutcracker, December 8th, UCLA's Royce Hall. It's a benefit to raise money to help, you know, give more art education to kids. And so we took the Nutcracker and changed it. I'm playing a rat. Raven Simone is playing Myrtle, the Mouse Queen. It's very funny. I hope everybody will come.
Oh, it sounds wonderful. I think we're just about out of time here, so
Okay.
I want to thank you both so very much.
You're
Thank you
welcome,
for
Teresa.
having us. I appreciate it.
Thank you.
Thank you.
Okay, let's do the print thing real quick.